Surgery should be considered in all persons with epilepsy who have not responded to their initial medications.
Right now, the working diagnosis of a drug-resistant epilepsy is a patient who has failed 2 or more well-tried medications and is continuing to have seizures. In such patients, if there is any treatable cure for epilepsy, then I think epilepsy surgery is the way to go.
So surgery can be an option once you sort of recognize that you have refractory or difficult to treat epilepsy. So the refractory epilepsy depends on where it's coming from. If it happens to be a generalized or global epilepsy, sometimes VNS or the vagal nerve stimulator can be very helpful. So it's something that sort of sits in a pouch in your chest. Oftentimes we'll wave it with a wand. That wand happens to be a magnet that will activate the VNS. That electrical activity that comes from that vagus nerve then goes to the brain, thereby stopping the seizure. Otherwise, if you happen to have a focal epilepsy, one that's coming from a certain area of the brain, then sometimes you can have other types of surgeries to help you treat that epilepsy.
If the patient has a focus in the brain that is causing the seizures and is located in an area of the brain that is not eloquent or it's not essential for our movements or our speech or our memory, once you identify this area, you can then remove this area without causing significant alteration of your physiology.
So that's oftentimes how we can sort of use surgery to be helpful for seizure treatment.